Vaccines with biosynthetic substances, usually peptide-based, perform the same task as normal vaccines. They imitate a viral infection so the immune system produces antibodies to defend against the real virus in the future. The only differences are that peptide-based vaccines are simpler, faster, and easier to produce, do not cause side effects, and only contain epitopes, which are the structures that antibodies bind to on a pathogen. These synthetic vaccines are slightly less efficient but do not have side effects.
Many synthetic vaccines are peptide vaccines. They're based off the natural source peptides, which are compounds consisting of 2 or more amino acids linked to the chain. They are formed when the carboxyl group of one amino acid reacts with the amino group of a different amino acid. Peptides are essentially the building blocks of protein, and they are the basis for synthetic peptide vaccines.
When creating peptides, which are the synthetic product in synthetic vaccines, an anion group of amino acids is attached to a carboxyl group of amino acids. The molecule FMOC, or fluoromethyloxyl carbonyl chloride, is used to protect from unwanted reactions when attaching these amino acids, by preventing the amino acid from coupling with itself.
There are many differences in the properties of biosynthetic vaccines and whole pathogen vaccines. The main biosynthetic vaccines are based off of peptides. Peptide antigens can be fully and precisely characterized as a chemical entity. Since peptide-based vaccines are produced almost exclusively through chemical synthetic approaches, these vaccines practically remove all problems associated with the biocontamination of vaccines. Because of this, peptide-based vaccines are less likely to induce autoimmune or allergic responses. Peptide-based vaccines also have other helpful properties that whole pathogen vaccines don't. For example, they are water-soluble and they don't require the cold chain. They are also stable under simple storage conditions. They can also be freeze-dried, and they can be made to target very specific objectives. However, peptide-based vaccines also have their own share of weaknesses. For example, it has poor immunogenicity, so it needs a toxic adjuvant to boost its potency. Peptide is also unstable in vivo.
Developing biosynthetic vaccines has led to a whole new industry of biosynthetic vaccines. It has also helped expand the pre-existing vaccines market, as the vaccines market has grown to be worth $32.13 billion and is projected to grow to be worth $49.27 billion by 2020, with an annual growth rate of 7.5% each year. As large an amount of money as this may seem, it's only about 2-3% of the total money earned by the worldwide pharmaceutical industry. Its rapid growth has clearly been aided by the continual development of biosynthetic vaccines.
Structure that is designed to use vaccines which contain synthetic substances that encourage the body to produce antibodies is the human body. The human body will take time to have the T lymphocytes produce antibodies which will fight the disease if it comes again. If the human body is an organic vaccine, antibodies will be produced to protect against the infection, and the T lymphocytes will remember how to make the antibodies protect against the infection if it comes again. Even though organic vaccines have seemed to be successful, they have a lot of drawbacks. Whole pathogen vaccines can create very strong allergic and autoimmune responses. The allergic reaction is not caused by just the pathogen. Instead, it is caused by contamination of the medium on which the microorganism was born. Synthetic vaccines are based off of peptide. The peptide vaccines have become very popular for humans since they don't cause autoimmune response. Although, the synthetic vaccine is worse at fighting the infection. It is safer than the organic vaccine, which makes it the best serving the human body over its worst partner.
The changes in society I envision for the future as a result of these new products include mass production of cheaper synthetic vaccines that cause less allergic reactions and autoimmune responses. The synthetic vaccines are becoming more and more popular because of the cheaper price and increased effectivity on more people. Because of the cheaper price, more impoverished people will be able to afford the vaccines. This will lessen disease in impoverished countries, making the world a healthier environment.